Hello friends and welcome to the channel. Now in this video I'm going to talk about this new NMC notice that has come up. It's regarding next. So this notice actually answers a lot of doubts which we had about this exam, right? So now this exam is a lot more clear than what it was. So number one thing which was already known, that this is going to be, the purpose of this exam is twofold. Number one, that it's going to replace your final prof theory exam, plus it's going to serve as an exam that provides you license to practice medicine in India. And second, it will work as NEET PG, it will work as NICT, right? So it will be the entrance examination for admission to courses for postgraduate education, right? Which means that this brings us to the end of the era of NEET PG or NICT. But what is not clear is when is this next going to be implemented. It is written in this that whenever next is in force, the equivalent existing examinations will be phased out or they will cease to be applicable. But they don't clearly mention which year they're going to start with. Well, is it the batch 2019 or 2020 or 2022? But probably what I feel is that the NEET PG is going to continue for at least another year or two, and then they will implement next, because this is still in sort of they're seeking comments on this notice. They're seeking comments on this on the proposed draft that they have published. So next is going to be a two exam format, which you already know, step 1 and step 2. The next step 1 will replace your final prof theory exams. You no longer have to appear in the university final prof theory exams. So this will be replaced by next step 1, and second, this will be an MCQ exam only. You don't have to write theory paper. This will be an MCQ, this will be an online mode, and this will be an exam that every medical student in this country will appear on the same day. So it's sort of unified exam. Okay. Now what is clear is that your part 1, your step 1, next step 1 will consist of 6 papers, and those 6 papers will cover subjects that are taught in third and final prof. Okay, so medicine and allied disciplines, surgery and allied disciplines, which means the other areas that are related to surgery, right, or other areas related to medicine, say psychiatry or dermatology, obstetrics and gynecology, pediatrics, ENT, ophthalmology, and then the applied aspects of your first and second prof subjects. So that is what will form the subject matter of next step 1. Okay, and they also mentioned that there will be one exam per year, and this will be held prior to the university practical exam. So this is meant to replace your final prof theory exam, not the practical exam. Practical exam will continue to be held by the concerned university or the concerned institution. Okay, and second, those who do not qualify, who have failed in one or more of these 6 papers, and they're required to repeat those papers, for them next step 1 supplementary examination will also be held once a year. The next step 2, which is a practical or clinical exam, it will be held in person, live. It's not online, it's live, and will be conducted by the concerned university or the concerned college. But NMC will provide them the standard, the guidelines on how to conduct that practical examination, and this will be a pass-fail type of an exam. You qualify or you're disqualified, something like that. And this will again be based on these core clinical specialties: medicine, surgery, obstetrics, pediatrics, ENT, orthopedics. So it will be an applied exam. Okay. Now, what about next scores, the step 1 score? What is its implication? The point is that they will provide you a score, and from that they will determine your rank in postgraduate entrance examination. So the admission to the postgraduate MD/MS courses will be based on next step 1 score. Okay. Now what is important is that the pattern that they've clearly mentioned. What exactly would that next step 1 exam paper be like? They mentioned that majority of the questions will test your comprehension, your analytical skills, your clinical problem ability, and this will discourage rote learning. They've clearly mentioned next step 1 format is intended to discourage rote learning by medical students, right? This is, I believe, It's important because it has become like an epidemic in our country. People from MBBS college, they just join coaching institutes, they memorize one-liners, or they just memorize their notes, and then finally appear in an MCQ exam and join the MDMS courses. But this thing is important because now you will have to focus on concepts, now you will have to focus on clinical problems and how to solve those problems, and the same will be tested in the actual exam, the next step one. So 65% of the questions will be problem solving, analytical skill type questions, okay? Recall type, just 10% that they've mentioned, okay? And in each paper, there are 6 papers as I mentioned. In each paper, 10% questions will be applied aspects of first and second prop. Okay, so if you're reading a particular subject, if you're reading a particular chapter from medicine or surgery, you will have to understand the anatomy that is relevant to that clinical topic, okay, or physiology that is relevant to the clinical topic, because that will form 10% of the paper. In other words, you don't have to read things that are clinically not important in anatomy, things that are clinically not important in physiology or biochemistry. There's a lot of stuff written in biochemistry, a lot of stuff written in anatomy and physiology or microbiology, things that may not be relevant clinically. So now, in a way, your burden is lightened by the fact that you only have to know the applied aspects of anatomy, the applied aspects of these basic sciences, okay? So they also mentioned that your core subjects, medicine, surgery, obstetrics, will have 120 questions. You'll be given 3 hour for that paper. Pediatrics, ENT and ophthalmology, 60 items each, and 1.5 hour for each paper. Now what they've also proposed is that this exam will be conducted over 3 days. So a day of medicine and allied subjects, so big paper, 120 questions, 3 hour duration, and then you'll be given a break of 2 hours, and then you'll have a short subject, 60 question, the 60 item subject, that's pediatrics, for a 1.5 hour duration. Then you'll have an off day, and then surgery and allied subjects, 3 hour paper, 2 hour break, and then followed by an ENT, 60 questions, 1.5 hour duration, so something like that. So overall you will appear in, so next is not a one step exam. Next, step 1 is about 6 papers. It's about these subjects, 120 question subjects and 60 question subjects, right? So 3 hour question paper followed by a 2 hour break followed by a 1.5 hour question paper. Then you come back again the next day, the day after that, okay? And then you again have 2 subjects, so something like that. So 6 papers on 3 days, and most of the questions will be clinical vignette type questions, which opens the gate towards USMLE type preparations, because USMLE exam by default is an exam of the same pattern. Their questions, almost all the questions are clinical vignettes. Almost all the questions, they test the core concepts. What is the next best, what is the most likely diagnosis? What is the next best investigation? What is the best investigation? What is the drug of choice? What is the test of choice? What is the surgical procedure of choice? All these questions come into play, okay? And so this is what I wanted to share through this video. I wish you luck for your preparations, and I wish you a very happy new year 2023. Thank you.